Krishna Chintapalli is an NHS doctor who studied hospital IT systems. He wrote an article warning about the possibility of a major shutdown just 2 days ago.
With us is Krishna Chintapalli, a junior doctor at the National Hospital for Neurology and Neurosurgery in London.
Dr. Krishna Chintapalli.
Dr. Krishna Chintapalli.
Well, Dr. Krishna Chintapalli.
Let's speak to Dr. Krishna Chintapalli, who's a neurology registrar at UCL Hospital Trust in London. Dr. Chintapalli, hello.
So, good morning. And as recently as January this year, a cybersecurity firm found that 1/3 of NHS trusts said they had been targeted by these same type of attacks by ransomware.
So why is that? Would you say that hospitals and organisations of its ilk are great targets for getting those ransoms?
First and foremost, we hold patient data, of course, and this data is sensitive. So this includes clinical information about patients, national insurance numbers, date of birth, addresses. So all of this can be sold by hackers, and we don't know exactly, of course, but unreliable estimates suggest maybe about 10 times as much as credit card information. They are big organisations that use computers for almost every aspect of patient care. And as I say in my article, so blood test results, imaging test results, clinic letters with the diagnosis for patients, even some of the software they use to operate some of the machinery. So there are different types of attacks that healthcare institutions are exposed to. In ransomware, they're not directly stealing the files because it's easier for them just to encrypt the whole device and then ask for a ransom to be paid. What we know is that these attacks do work by encrypting the computer completely so that it is unusable. Now, if that happens in a healthcare organization, of course, you cannot access critical data for your patients.
And were you surprised by the scale of this attack?
So all the previous attacks, to my knowledge, within the healthcare industry have been single organizations, at least the ones that have gone public. So this surprised me a lot yesterday when I heard about the scale of the number of organizations.
Why do you need to be aware when the NHS has its own IT specialists who, of course, have been working very hard on trying to get everyone back to normal today?
Well, often the first line of defense for any of these attacks is the user of any computer system in any large organization, not just the NHS. I've compared it to hand hygiene, which we're familiar with in hospitals, washing our hands before every contact. And digital hygiene is applying the same to computers, being very careful when you're using a computer in a healthcare organization. And also, if a computer is compromised, securing it, just like isolating an infected patient to prevent spread to others, isolating an infected computer, shutting it down, disconnecting it from the network.